From me, I know we allow now further down the line, but for like medical students coming through medical school, what sort of advice would you give them so they can better tailor their skills to better use in medicine? What would you say to them if you had a bunch of first year medical students starting out for the first time?
So I would say, in terms of skills, so if you're first year, what I will say is do not neglect your basic sciences. So there's a reason why we start with basic sciences and then move on to the clinical years, traditionally at least. Because, as the saying goes, and anyone who in future will ever do a job in emergency medicine, for example, it goes, you're much more likely to find an uncommon presentation of a common disease than a common presentation of an uncommon disease. And what's going to save the day? You're in medical school, you're going to learn all the classic textbook presentations, but real life level textbook. And what's going to get you through the day and oftentimes get you close to the answer is the basic sciences. And I breathe. One touch feels skinny.
Can you just tell us a bit about yourself, your name, and what you're currently doing at the moment?
I'm Stephan. I'm finishing foundation training, currently working in emergency medicine, going on to do an F3 year, to pick up general shifts in ED, general medicine for 1 year.
Good. And can you tell us what's an F3 year for those who might not know?
So an F3 year, it's a year that you take out of training after your F2 year, so after completion of your foundation training. You can do various things with an F3 year. A lot of people, some people may use it to take time out of training to rest. Other people may use it to build a portfolio. So, for example, taking up a teaching fellow post, which a lot of people do. Because if you have evidence of teaching on your portfolio, that counts for points towards various specialty applications. Or you could, in my case, take an F3 year, one, to take a bit of rest, but also to explore interest, necessarily within medicine or outside of medicine, outside the curriculum. So I'm interested in humanitarian work. So one of the reasons I'm taking an F3 year is really just to explore options of career options in the humanitarian field, with the aim of doing a humanitarian trip at the end of the year.
Okay, that's amazing. And I think that's the beauty of F3. You can make it whatever you want the year to be. Well done for doing that. And all the best with your humanitarian work and like the exciting stuff you're going to do. Can you share a bit about your journey into the medical field and like what inspired you to pursue this career of becoming a doctor?
So mine was a bit of a long journey. To be honest, when I was growing up, I never really had much drive towards medicine. In all honesty, my parents actually wanted me to do medicine. So I think it kind of started from a position of I wanted to do it because my parents wanted me to do it. And I think for lack of direction, I ended up doing biomedical science, which I really, really enjoyed, at least from a science point of view. And at that point, I was already thinking, I can't see myself doing anything apart from medicine, but I don't actually really want it either. And I think midway through, the biomedical course, I was like, you know what, actually, I can't see myself working in a lab. I feel like I really enjoy the science. I really enjoy studying the human body and everything that can go wrong.
Nice.
But at the same time, I need the human interactions. I love the communication side of things.
Yeah.
And so that's when it just clicked that, you know what, I should probably just do medicine.
Okay. Oh, that's good. Thanks for sharing that. And I think I think parents still have a say in terms of what careers that you should do, because some parents do pay for tuition fees for their kids and everything else, and most parents do have good intentions for their kids, which is sort of not similar to what kind of advice you find today. People be like, "Oh, ignore your parents and like just go do what you want to do." But yeah, you really don't have much experiences at the stage where you finish secondary school. So I think there's a place for listening to your parents and like just at least hearing what they have to say, if that makes sense. Yeah.
Yeah, definitely.
Yeah.
Keep an open mind.
Yeah, keep an open mind. Yes, definitely. Definitely. And since you've sort of decided to become a medical doctor, like what were some of the key challenges that you faced, especially during medical school and in the early part of your careers? I know you're still in the second year of your training, but if you can just share with the audience what sort of challenges that you have experienced along the way, and how did you overcome those challenges?
So I think first of all, studying medicine right from the get-go, even in medical school, is hard. It's a lot. Um, and I think it's quite easy to be overwhelmed. And it's also the other thing to point out as well is that it's a very long journey. So medical school in itself is a long process,
Yeah.
but the journey doesn't end there. If anything, it's even longer after that.
Mhm.
Foundation training, GP training, yes, that's still another 3 more years.
Yeah.
If you want to be a specialist, that's another 7, 8 years, you know.
Yeah.
And then the constant grind is quite tiring. And I think one of the most important things is that you just have to be kind to yourself along
True.
the way.
True.
The other thing that I find, so you have to be quite resilient. It's depending on your personality, you may thrive making medicine all about, your life all about medicine, which is fine if that makes you very happy. But I
Yeah.
think personally, I think what works best, and from what I've gathered from talking to other people as well, is that I think you have to try your best to be a well-rounded individual. So
Mhm.
it's best to have interest outside of medicine because that keeps things fresh.
Yeah.
Um, and I think there's going to be a lot of pressure to always be, competitive. And yes, it is competitive.
Mhm.
I think at the same time, you just have to pace yourself.
True.
Those thoughts. I think what's But I think what's also very important is that, and you probably ask yourself this question quite a lot, at various stages in the journey. But you're probably going to ask, why you're doing this in the first place. And
Mm.
answers could be very different.
Yeah.
It can be anything from being very altruistic to just being about making lots of money in private care.
Yeah.
It's very different. But at the end of the day, I think you have to be clear to yourself why you're doing this, because I find that once you lose the passion, once you lose the interest, it's going to be
Yeah.
quite hard to justify to yourself why you're working those hours.
True.
And as you're going through the state of training at the moment, which is long hours, but it doesn't really feel like you're being remunerated appropriately for the hours and the work that you do.
Yeah.
So you just have to be realistic with yourself.
Yeah. No, that makes a lot of sense. And like I said, there's a very long career. Like it's important to maintain that passion. Um, and be altruistic. I think there's a balance of both worlds where on one hand you want to save the world, but on the other hand you need to make money to survive so you can save the world. So unfortunately, the stress on the job, how difficult it is, a lot of people lose that passion very early on, and it just becomes all about making money. which I think a lot of people kind of like struggle with if that's the only thing that's driving you. But everyone is different at the end of the day. Yeah.
Yeah.
And saying like our careers are like long, what kind of significant trends have you seen, or what sort of advancements do you think might be coming into medicine in the next few years?
So I think so. Just within the medical field, I think for example, I mean, gene therapy is a big one, really. Um, so at least within the developed world, I think we're definitely moving towards a more personalized form
Medicine.
of, um, and I think having some kind of basic knowledge around it is useful.
Mm,
Potentially, so on, genetics, um, potentially even around some laboratory techniques as well. Um, and I think, yeah, I think even in advancements in medicine. I mean, you've got talks about AI as well.
yeah.
I think the question would be, I mean, everyone's going to be different, but I think you're going to have to find a way to to where to coexist. I think with
Okay.
AI, uh,
Yeah.
because some may feel that AI is threatening the jobs of doctors, other,
Mm,
and therefore we should not use it. But the way I view it is that I think it's just a tool.
okay.
Um, it's probably going to get more intelligent along the ways. Um, and we will just need to adapt really to work alongside it, because I think they're
Yeah.
useful. There's useful to AI, and it shouldn't be disregarded. But I think maybe where the issue might come from is the ethics around the use of AI in
Okay.
medicine, because I feel like,
Okay.
for example, with AI, you know about ChatGPT, we can ask ChatGPT to create anything.
Yeah.
Um, and the to an extent, the process, that creative process is not dissimilar to how um, clinicians and people in general get good at their jobs. It's just experience. So if you feed the AI program, lots and lots and lots of data points, which is what's actually happening now when you ask ChatGPT, for example, or AI to create an image, it takes information from very many different sources and then put something
Yeah.
together. It's a similar process to people, how people normally do it. The question is, if it gets to the point where we start trying to get AI to run entire consultations, which to an extent we've
Yeah.
already are, to
Mm,
in a little way, like simple flow charts and that kind
yeah.
of stuff. So yeah, I think that's something to watch for. Just AI is definitely going to be a big thing, and I think
Mm.
having a think about the ethics around that is going to be quite important.
Yeah, that makes a lot of sense. That makes a lot of sense. For me, I think technology is going to have a major role to play. Like for example, where we work at, you have the system which we rely on, which is V6. And whenever it's downtime, we're all struggling to get back to basics. So it's become a huge part of our lives. Like we no longer write on paper. We no longer even prescribe on paper. Paper is used less and less and less. And like a few weeks ago, they hacked the one of the London Trust. So security and technology is just going to have a massive role. So we all have to adapt. We all have to evolve. And I think technology be used more during consultations, whereby the computer just transcribes and orders the notes and everything. It will save time, but I think the
Mm.
future clinicians have to start developing those skills today. Like I think at some point people start doing degrees in technology and AI, and these are like medical doctors. You have to have more than one specialties, and I think that's where healthcare is going to trend towards. So it'll be an exciting space to watch out what's happening in the next few years. Yeah. And leading on from here, I know we are now further down the line, but for like medical students coming through medical school, what sort of advice would you give them so they can better tailor their skills to better use in medicine? What would you say to them if you had a bunch of first year medical students starting out for the first time?
So I would say, in terms of skills, so if your first year, what I will say is do not neglect your basic sciences. So there's a reason why we start with the basic sciences and then move on to the clinical years, traditionally at least. Because, as the saying goes, and anyone who in future who will ever do a job in emergency medicine, for example, the goes, you're much more likely to find an uncommon presentation of a common disease than a common presentation of an uncommon disease. And what's going to save the day? You in medical school, you're going to learn all the the classic textbook presentations, but real life level textbook. And what's going to get you through the day and, oftentimes get you close to the answer is your basic sciences. Because when it doesn't fit any textbook presentation, you're going to have to take a step back to try to work out what is the underlying process. And I think it's very easy for, especially people who are new, to medical school, starting off in the first, second year. Especially if it's a first degree, you just want to enjoy your university experience, which is absolutely fine, and I think you should. But do not neglect the basic sciences. Like, do not be in a hurry to get to your clinical years, to get onto the wards and start seeing patients, because it will come. You don't have to worry about it. But the basic sciences, you can't build on a foundation you don't have. And if you neglect your foundations, you will struggle during your clinical years. You might be better at the thing about foundation, and the reason why I say it's a foundation is because it's like when you're building a skyscraper, right? The higher you want to build, the better your foundations need to be.
That's true.
The longer you have to, the more time and effort you have to spend on your foundations. And if you want to be good at your job eventually as a doctor, you're going to have to be decent at your basic sciences.
That makes sense.
My advice would be, especially to like first year medical students, that it's easy to neglect the first 2 years and saying that it's not really clinical, it's not that important. But actually, probably the most important years.
True.
So don't neglect it, is what I'll say.
Okay. That's very true, Stephan. Thank you very much. And I remember, I wish I paid more attention. Not that I didn't pay attention, but I wish I paid more attention. But like those things you learn, you get to see them much later on. So no knowledge is ever wasted. And I speak from firsthand experience as well. Yeah, thank you. And in terms of what your plans are, Stephan, what specialty do you want to go into after your F3 year?
So my interest is in hematology.
Okay.
Because as I said, I think over the years, and just kind of like going in different placements, I think hematology. I think I realized that I like diversity.
Okay.
And I find that personally, hematology is one of those specialties that offers you a lot of variety, not just, not just clinically, but just scientifically as well. Because I'm genuinely quite curious. I do quite like the idea of research, reading stuff up and taking really complex issues and then trying to distill it down to its bare sort of conclusions and, its salient points.
Yeah.
And I think with hematology, there's so much research going on and it's really at the forefront of research. With all this gene therapy, you've got so many blood cancers, all that is. Blood cancers are among one of the most treatable. Some of these blood cancers, like leukemias, they're amongst the most treatable and curable cancers in the world.
Yeah, that makes sense. Yeah,
and I think it's there's a lot of room for improvement and advancement in hematology. In terms of workload as well, you've got it's a little more unique in the sense that you do cover the lab. So you work in a clinic, you do cover the lab as well. So if you're into that kind of thing, you look and look at the blood films and make diagnoses. And so I think it's very varied because it's scientifically it's very challenging. It's very interesting. You've got a research element. You've got a different healthcare settings, but equally, it's not just a specialty that is for nerds, if I may say so. It's we don't just sit in a lab and do nothing. It's because it's very holistic, especially from the hemonc side of things. Because you have so much palliative care going on. You patients through the journey. Because in hematology, there are lots of inherited conditions as well that runs in itself. Oftentimes in the clinic, you're going to end up with treating multiple generations of the same family or in the same clinic.
Okay.
For example, you could get hemophilia as well. You could get sickle cell. If it's passed on, some father has it, or then it passes on to the kids, and everyone's the same. I think it's an app which can be quite rewarding. I think.
I think so as well. And thank you very much. I actually wonder, you've actually answered the question, what are the common misconceptions about hematology? And I think one is just think they're just smart people sitting in an office and they don't do anything. And thank you, you've done well so far. The question I have in mind is, what sort of informed your choice to do hematology? Was there a particular moment that you can remember at that particular point in time that you say, yes, I definitely want to do hematology?
So I think that my interest in hematology started with my first degree. So I did biomedical science, as I mentioned earlier. So one thing I knew is that I really hated lab work. But the only thing I enjoyed in the course, strangely enough, in terms of what point of view, were the blood films. I'm one of those weird blood films, very pretty.
It does. It does look pretty,
And so I self-organized a sort of a placement in medical school in SSC in hematology 2 weeks in the Royal London Hospital, which covered main coagulopathies, so all these clotting issues and stuff. And I really enjoyed it. And I think I say that people make the experience as well. And that the hematology consultants, the registrars, they were absolutely fantastic. Everyone was just super, super nice and friendly, and very willing to teach, which obviously added to the experience. But I think what I'm also realistic, because I think especially when you're starting off, you can be quite interested in a lot of different specialties and say, oh, I want to do this, blah, blah, blah. And so I think it's quite easy to just, say, oh, I'm very interested in this because of one-off experience. So I thought, what, see if the interest remains, after, so waited till third year in medical school, and then had a 1 week hematology placement. I still enjoyed it. And I said, okay, so far so good. And I think I had heard of a lot of people who had dropped out from hematology training because I think it's quite sad. They couldn't take the emotional toll sometimes. So on the hemo patients, and they just die. Something, with the poor prognosis, just having to deal with that on a daily basis is quite difficult. So I thought, let me think about it, and so I self-organized another SSC in my final year of medical school, focusing a bit more on hemo. And I still found it very interesting and rewarding. And I think depending on the person, the conclusion I came to when I thought about this is, I think depending on your attitude towards palliative care, that is going, just in general, not just hematology, that's going to your, I suppose, your ability to cope with the emotional challenges of the specialty in hematology, because some people may see palliative care as very depressing, which it can be, all left, right, center. But I think the way I see it is palliative care done right, or palliative care done well, is still medicine done right. So I mean, because whichever specialty you're in, you're never going to cure everyone.
That's true.
That's not to say that there isn't things you can still do to make people's lives better.
That makes sense. Yeah. It's like you said, it depends on how you view the specialty, because the same way someone can see pain in a situation, the other way, like, you're helping them in their dying moments, ease their suffering. So you are doing them a world of good at the time when life is difficult. Like you said, it's all about your point of view and having that grounding to know, okay, where do you think you're fitting in the whole process? And I think hematology is actually a very exciting specialty in terms of the research and what's coming out. And like what you said with gene therapy, you can do a lot, and like you can see what you do, it makes a difference to people. And like hematologists are never ever going to go out of a job, because you're always needing them, you're always calling them. They're like the microbiologists, you can never get rid of them. Yeah, that's good. Yeah, thank you so much. My other question is, how do you stay motivated to continue to grow as the next few years come up, professionally and personally, because it's a very demanding profession. So how do you stay motivated?
So I think, as I said, I think know yourself.
Sure.
So I think it's quite important that at every step of the way, you just learn to sort of take stock of where you're at in life, in your training, or what's important to you. It's okay to sort of take a step back and just review the entire situation. It's a training pathway that you want to do. Have your priorities in life changed? So, for example, when I was a bit early on in my training, I was thinking that, I've already spent so much time studying, uni. I just want to, I've got all my friends kind of, they've got their jobs already settled in their careers. I just want to finish this training and then become a consultant and done. But I think along the way I realized, it's a journey. Important to me is I've got hobbies as well, that I'll keep up with. So, so I think it's just being aware of what's important to you at every stage, every step.
Sure.
And being deliberate to make time as well to do those things.
Okay.
So if interested in various whatever hobbies it may be, you have any hobbies, or I think, and even just especially people, because the hours can be quite long, quite demanding, and especially if you do night shifts, come back tired, you actually a bit of a survival mode.
Yeah.
And I think depending on your personality, you may be extroverted or you may be a bit more introverted, whatever. But I think, at least in my experience, I think it can be quite easy to silo yourself in these situations because you're just very tired. But
Yeah.
I think all the more you do have to try your best to be intentional to meet up with people. You know, so like family, friends, just have fun,
Yeah.
and don't let work consume you. Don't take work back home with you.
Yeah.
That's I think that's probably my one of the things that the biggest takeaway I've had.
Yeah, that makes sense. Thank you very much. And I'm going to be borrowing on some of your advice, like not taking work back home, and like yeah, because I've fallen into the habit of bringing work back home. But yeah, excellent point. And like in your head, you know what you should do, but like sometimes you actually don't follow through. But thank you very much. Those are helpful points. And my final question is, if Stefan, if you were to go back and give your younger self one piece of advice, what would it be?
Don't take yourself too seriously.
Yeah, I love that. I love that.
Like you said, medicine can be it's a long journey. It's hard.
Yeah.
It's hard work. And it's very easy to feel like, and especially I think in medical school, like you really feel the competitiveness, the course, like everyone's just racing for the top, trying to get top best marks, and sometimes it becomes a bit of a crap race, and that can get to you. And I think even after medical school, once you start working, and of course, it's a big responsibility,
Sure.
because if anything
Yeah.
goes wrong, the consequences can be quite serious. But
Sure.
I think you just have to learn to laugh.
Yeah.
Every um, yeah, and I mean, of course, there's a professional image, there's a professional side to the work,
Sure.
and there's an expectation and a standard that we are expected to sort of adhere to. But equally, when you interact with, what I'm saying is that when you interact with people, when you interact with patients, your colleagues, um, if you can learn to drop a little bit of that formal professional image,
Yeah.
and just be a little more of yourself,
Sure.
goes a long way to making
Yeah.
feel better, making patients feel better and more at ease,
Yeah.
and just setting the mood and making just everything a lot more pleasant.
Yeah. Yeah, that makes sense. Thank you so much. Thank you so much. For me, like lately in the last 6 months, especially, being in pits, like coming and just seeing those little ones go around the place. They laugh, they cry. Like I've borrowed so much of their emotions. Like they have, most of them are not bothered about what's gonna happen in the next week. So whenever I see them and I see them smile, it's a reminder to me like you just have to smile. Like so for me, they're like I learned so much from seeing little ones, and like you said, never take yourself too seriously. Like learn to really just be in the moment and enjoy the journey. Because yeah, it's competitive, especially in medical school. But like it's the skills, the people skills that you develop, that is what's going to carry you for the longest period of time. So yes, thank you very much.